Welcome, everybody. Um, this is Ada from the Pond, and today we're going to um, find stories in data. So this is a bit of a retaliation from a couple of weeks ago when Jonathan was given a dataset by me and was looking for data in there, and now I'm going to look for stories in a dataset that Jonathan gave me. I've never seen these datasets before, so I am very excited. I have these datasets locally, and I've seen the names, so I kind of have a hunch what they're about, but I haven't seen them yet completely. So yeah, let's get started. So first, Jonathan, I would like to ask you, what datasets did you actually give me?
I stole these, or borrowed them, from the Tidy Tuesday project, which was started for our users, and now it's used by Python users as well, where people do exactly what we're doing, except they're not looking for stories, they're looking for visualizations. So this is taking, I'm going to have to check what the exact source is, but it's internationally collated data on health spending in every country in the world, but I narrowed it down to just the EU. But I've also I put a little bit of US data, but not health spending data, in case you want it, and you'll see why when you get there. I have a suspicion of where I would look for stories, so I hope I haven't prejudiced it too much. But you have got 3 not huge data sets. Some of them are there's quite a lot of data from the World Bank, and it should be apparent from the column names and contents what you're looking at. And I've already chosen to show you just one metric, which is constant dollar value for 2023. So all the prices are already indexed at the 2023 level. That's all I think I need to tell you.
All right, great. So I'm going to share my screen. I hope you can. I think this works. So I am actually going to go to my command line and I'm going to fire up Claude. So using Claude is basically, I have moved all my coding to Claude these days. And that doesn't mean that I don't use other tools, but I do start with Claude basically always nowadays, and I'm gonna show you why right now. So I have this data that I haven't ever seen, right? And I can normally, what I would do is I would go to the Jupyter notebook and just do like my, this the usual thing you do when you look at data is like you count your rows, you count your columns, you look at the columns, you see what they are, you look at your descriptive statistics. Now, this means I have to type it all. When I go to Claude, I'll be like, hey, Claude, there are 3 datasets in the data folder. Please do some explorative analysis. I can also say I have never seen this data before, so I would like to know what is in there and how the data looks like. I'd say what are there missing values? Is there anything that needs cleaning? Like I would just instruct it, please explore analysis and output I'm gonna say just output a small overview for me. Okay, so and then Claude is gonna do leavening, and in this time that it's thinking, I can also talk to you.
Yeah. So this is the kind of cheating I expected from me sending the revenge. I've been debating whether to use Claude in my searches for stories. I use Claude with it as Posit Assistant. So within RStudio,
Yeah.
I have a Claude instance that runs there, and I can do exactly the same as you've just done. I have a little chat line, and I have to say, a couple of times it has come up with lines of inquiry that I wouldn't have thought of myself.
Yeah. Yeah, and I think this is where there's also this like everybody's thinking like people are saying like yeah we're not thinking anymore because we have these tools that think for us.
Mm,
But I do think it's all in all it's a cooperation that I
mm,
now find with the robot is where the robot comes up with something and then I reflect on it, and then I come up with my own thing. So it's giving me already some
mm,
results. So I'm just gonna start at the top, and what's gonna say what it says. So the first data set is about health expenditure by financing type, and we have 2,000 rows from 27 EU countries. This is the year spans, and this is the unit you were talking about. This is the constant US dollars. There are no missing values. Super. So we have expenditure types. Um, I don't know what this is actually because it doesn't really show me as a column. So I might ask it. External health expenditure, current health expenditure. So I don't know what this is, so I'm going to ask it later. So then EU spend purpose. Health spending by purpose or function. Again, 2,500 rows, 27 countries. This is a shorter range, which is also something that NICE flags. And we have the same unit, which is very important.
yeah.
There are no existing. There's 407 missing combinations. So spending purpose, curative care, palliative care, ancillary service, medical goods. Okay, so I do assume this is a column. So other gaps to be aware, other care services are missing, rehabilitation care missing. Okay, this is when we're starting to analyze data sets. Like it's equally important to know what's missing to what is there. Putting that out there. And life expectancy. So we have the EU plus US, and for a couple of years, and there are structural gaps. All right, Slovakia is missing entirely. And we have some floating point artifacts. Oh yeah, which this means these are just basically very long floating points that
Yeah.
should be rounded. Okay, great. All right, this is also very interesting. So important. So for example, we have discrepancy in the names of the countries. So we have 3 data sets, right? And not every country is called the same. So especially here, Netherlands needs harmonizing. So the US appears only in the life expectancy, not in the spending data sets. So we cannot make any comparison with the US. And we cannot say anything about Slovakia and its life expectancy. Year cover mismatch means that we only can compare the years that we have.
Mm.
So when you see this, Jonathan, like I mean, this data set. What do you think?
What do I think in terms?
Yeah,
Well,
just
uh,
reflect on what is here, and like I mean, don't give me necessarily clues, but
yeah.
does it?
I hadn't noticed that Slovakia was missing, which is interesting. And I'm not sure why that would be,
Okay.
given the source was fairly comprehensive. And actually, for some of the years, Britain should have been in there. Oh, that was my filtering. I just took the current 27 countries. It could be that it's my fault. I had a list of 27 when I filtered, but yeah.
We can also just do very like old school looking at the data
Yeah.
step where we look at the life expectancy. So
Yeah.
here This is where Slovakia should be missing, right? We can do this in
Mm,
every. Oh,
I saw it there, though.
no, this is Slovenia. I think is how is the other Slovakia? Yeah, if I look for Slovakia, no, it's not there. So that is correct.
True.
And I also want to actually see these two because I have instructed Claude wrong at some point where it's not really giving me all the overview of all the columns as I wanted it. Okay,
Yeah,
so
because
this way,
it's done it. It's taken the expenditure type as a separate way of. It's pulled out.
yeah.
It's done a count. It's done a count basically, but instead of putting it in the property or whatever, it's done it as
Mhm.
part of its general
Yeah,
um,
it's really gave me
summary.
the unique values for
Yeah,
it, which is also good.
yeah.
Because
It's not. Hmm,
it's
yeah.
important to know that what unique values there are, but for the same like what I would also maybe like to know is like what is the distribution of these units? What is the distribution
Hmm,
of this number? Gave me the distribution of years and the country, so it's quite okay. But now I see it, and now that I actually look at the data, which is also of course something that you need to do, and don't trust the robot blindly. Okay, so all right. So I have my information now, so I
mhm,
have to think about this a little bit. So we have the expenditure type. Um, what kind of stories could we make with these? We have like this domestic private expenditure, external health expenditure. I kind of want it to explain to me what are these expenditure types.
hmm,
Can you please explain to me what are the expenditure types? Because I don't know these. So um, find the source because I don't trust the robot. Um, because it,
hmm,
it it has a lot of information in itself, like in its training data, but um, I can review myself. Okay. It has like what makes them really useful, and I like what you said. Like sometimes they come up with ideas that you don't. They have a lot of information in themselves. That's why they can kind of think with you, but they don't. I mean, they're still statistical machines, right? So they are bound to make errors. Um, so sometimes they say things that sound true, but they're not, and sometimes they say things that sound true and they are. So you can never say. Um, okay, so now it did a web search. This is good, and I can see what kind of web searches also did. And it found where this comes from and what kind of framework it follows. This is very useful information for
hmm.
me.
And it
And it
did that.
also, sorry?
Yeah, so it's done it by actually looking at the web, and it looks as if it's brought some sources back. So it hasn't just hallucinated some names.
Yeah, yeah, exactly.
Yeah.
So this is sources that I can review. Again, is this actual sources? Yes, it is. Okay. So
Mm,
you also like, I think what I remember like a year ago, maybe if you ask it to give a source, the sources were hallucinated. I think
mm,
now that it did a web search, the sources are probably correct. Um, but yeah, we always need to double check. So here we have the system of Alice account. This is the SHA 2011. So I'm just going to look if I can find my current health expenditure, or maybe I'm going to look for this abbreviation in this PDF. How do I search in PDF here? Mm, I already did. It didn't find anything. Hmm. Okay. If this was a real life situation, I would like spend time to check whether this is true. At this moment, I'm going to kind of assume that because it did a web search, then there's a large chance that this is true. But
Mm.
if you do anything for publication, you really need to double check this. So what it captures is the first one is the total spending on health, and then the portion of um, that is covered by domestic, by private, and by foreign sources. Oh,
So
interesting.
international aid.
Yeah, that's interesting. Okay. So, what am I doing here? I'm not only exploring myself and learning about this data, but I'm also teaching Claude more about this data by building up this context. Okay, and context building is super, super important thing. So everything that's in the context. So if you don't know about the context, I can also show you. So if I say slash context here, it will show me everything that's in the context window. So the context window has a certain amount of tokens, and if I have a conversation with this robot, it will fill up the tokens. So the tokens that I give it, which are my questions, and token it puts back, it all becomes a part of the context window. So as you can see, like 6,000 tokens and another 9,000 tokens are just system prompt and system tools. This is something that is in there all the time. Then we have skills. I don't know what skills this particular skill is, probably web search, some sort. And these are the messages. So, and this is the amount of space I still have within this context. And these are skills that are
Mm.
kind of my personal skills that I can give it to it. So, for example, I have this skill for investigative search assistance, which I'm not going to get into right now, but I use that when I investigate um, topics, and that would also then be a part of the context. So, and this context is very important because now at some point I'm going to tell it, think with me about interesting angles to stories from this data, right? But the more we talk about this, the better the robot can think about these angles, right? So, and the fact that it already did this analysis and it knows what are the problems with this data means that every line of code is that it's going to write from now on is going to take these problems into account because it's
Hmm.
in its context.
Hmm.
Does that make sense?
Yeah.
Yeah.
And have you also given it a sort of overall context, like who you are and what you know about code or statistics or anything, where you can tell it that way it doesn't patronize you by pretending you know nothing? Have you have you done that
uh,
kind of prep as well?
no,
Okay,
no, I have not yet.
but
At
it
some
could
point, I'm gonna,
patronize you.
and that's fine,
Yeah.
Like I also don't know everybody, but everything. But what I where this is important that it knows who I am is in the moment where I'm going to ask for stories
Yeah.
because a data analyst, a business data analyst, or a healthcare data analyst will need different
Mm.
insights from this data than a journalist, right? Because we are really looking for stories, and this is also where it gets a bit tricky because in my experience like these robots are very easy, very, very eager to please. So when you say, give me a story, it will make its utter best to create a story out of nothing sometimes.
Yeah.
So it will then say like, oh, but here is the catch, or here is this is actual story. And I'm like, okay, that's why I have this research assistant skill where I ask it to falsify itself as well. So um, I I think maybe I understand enough for now to um hey, we have somebody joining.
Yeah.
Hello. I can't see you because I'm sharing my screen. Um
Oh, it's gone again, I think.
it's gone again. Okay, fair enough. Um so I think I understand this data well enough. To recap, we have all these different health expenditures. I think like maybe focusing on this domestic, private, foreign parts is could be super like interesting.
Hmm.
So maybe because I might want to focus on that, I'm going to go back to Claude and say, okay, that is
Okay.
interesting. And I'm going to say, um, these are, I, okay. So, um, make me a simple analysis of the expenditure types per country. I am curious whether there are any notable trends and outliers. Make me a simple
Mm.
exploratory. I'm still didn't tell it what is my purpose.
Mm.
And this is because I don't want to sway it um, in the journalistic thinking yet. I'm still building the context now.
And it doesn't remember from previous information that you are a journalist.
No,
Ah,
no. I know you can
yeah,
turn
you
that
can.
on.
Yeah,
I really don't want that.
yeah.
It's it's because as I said, so this context is super important
Mm.
because context is really everything. And only also the fact that I have system prompts here and system tools, they're already doing something to my context which I don't have any control of. So I kind of want to have as much control over my context as I
Yeah,
want to. And if I would have it remember previous conversations, that would be adding more noise.
yeah.
Just for your information, what it's doing here, it's actually writing little Python scripts that it's executing in the command line. Yeah.
Hmm.
So this is what it is. Um, so if I wanted this, I could also have it save these scripts, and I'm gonna do that at some point. All right. So it says Germany dominates, followed by France, Italy. The smallest spending is Malta and Cyprus, which is kind of population size. That's what it says. So mostly government funded is Luxembourg, Sweden, Czech, and Croatia, and Denmark. Most privately funded, Greece stand out at 50% private. Crazy. Is it out of people's
Well,
pockets?
that's a
Oh yeah.
strange way of putting it because, of course, my health comes out of my pocket. It's just it comes in taxes, not in a specific insurance. So
Yeah, true.
there's a
True.
kind of myth. It's a slightly American way of looking at it.
I think this is a great observation because this is also shows you what kind of biases are
Mm.
embedded in these
Out of
models.
people's pockets. Everything's
Yeah.
out of people's pockets.
Yeah. Yeah. I think it's a wonderful observation um because this is like if we take this over like verbatim, is that even
Mm.
how you pronounce it?
Verbatim, we say.
Verbatim, thank
I
you.
don't know what the Romans.
Uh, if you take this over verbatim into an article and don't think about it, then
Mm.
you are actually really conveying a opinion.
Yeah.
So yeah, yeah. And this is where my point was of I don't believe that these models necessarily make us think less. I think if it like it when things like this happen, it actually prompts us to think more
Mm.
um, about the world and what we get out of here. So
Mm.
I don't know. That's my opinion. Anyway, let's get back to it. So then we have Latvia, Portugal, Bulgaria, Cyprus. Okay, now it says
Yeah.
Cyprus story is the biggest outlier. It went from 41% government funded to 77 in 23, so dwarfing every other country. This corresponds to their Jesse national health system launched in around the COVID time.
Yeah.
And this information, it didn't Google. This is something that comes from the training data. So this is the knowledge that is in the model.
Mm.
Again, I find that it's often right, but it needs we need to
You need
be
to check it.
very aware. Yeah,
Yeah.
we need to check it. Okay, so and also this is a
But
complete
also,
structural transformation, you know.
but then it says, you say it's dwarfing, 35.7 percentage point shift. But then if you
Yeah.
look at the newer EU members, the next line down, saying
Mm-hmm.
Malta 261%, Ireland 234, those are very big increases. Fastest growing
Yeah.
health systems. I'm not sure this thing from government funded.
I think this is more like health
Mm.
systems.
Yeah,
So I
yeah, yeah.
think that's the overall expenditure, not the
Mm.
government funded expenditure.
So, yeah,
So, and this is also interesting, right? Like
that's the one that caught my eye. Yeah.
we have actually growing health systems in the newer member states. I think that's an interesting analysis that
Mm,
maybe I would go into later. So we have the COVID impact, and this is also something I didn't ask it to do. This is what it
mm,
came up with itself when I would be
mm.
like, "Hey, this is health," and give me trends, and then it knows the years. So
He knows about COVID. Yeah,
yeah,
interesting.
yeah. All right. Most in countries are most increases. Okay, so yeah, we don't really see that much lasting effect in most of countries, and government share is eroding in some places. So in Greece, is less
And we've got that
because
language again. Households shouldering more of the cost.
yeah, exactly.
Moving it to your tax base from your tax base to some
Hmm.
other source.
Yeah, yeah. I think the kind of yeah, there is a deliberation of like, yeah, because you have a mixed private and public, right?
Mm.
So yeah, because you can then, for example, in Slovakia, you can choose whether you go to private healthcare or to
Yeah,
public. Um, and in that case, you pay the taxes, but you also have to, right, pay the private one. So okay, anyway, several used to be European countries saw large single year shift. Okay, that's also interesting. All right, so these are already, I'd say, here I already have a couple of ideas for stories that I could dig into deeper, right? So,
yep.
for example, the fast growing health systems, or restructuring of Cyprus, or
Mm.
um, the how much the private and public split, and how what is that. So I don't want to do anything yet because I have these other data sets in here. So I'm going to ask it to also find me now maybe correlations between the life expectancy and any of these patterns. So do we see any correlations between life expectancy and any of these trends? And again, I'm giving currently, I'm really giving it like free reign. It
Mm.
can do anything, which means that I'm also missing things, right? Because I leave the model with lots of creative choice. But it really depends on your story, what you
Mm.
want to do, right?
Yes.
Like, because I don't really like, if I really had a question for this data set, I would probably narrow it down quite a lot, but we are exploring. So I don't really have a single line of questioning
So at
currently.
this
That's why
point,
I
just
gave
to be
you.
clear, you're
Mhm.
still you don't have any lines of inquiry you want to pursue. You're still exploring. You're still letting Claude help you explore.
Exactly. Yeah.
Okay.
All right. So here's what the data shows, and this is also like let's see what it outputs, because the wording is important here. So do we see any correlations between life expectancy and any of these trends? If I'd say I want to find correlations between life expectancy and these trends, I might get a different answer,
Mm.
right? Because as I said, these models are really eager to please.
Mm.
So just by wording, you can really nudge your results,
Mm.
which you don't want. So the correlations are surprisingly weak, it says.
Mm.
Okay. So changes over time, the correlations nearly vanish. There are some outlier cases, high life expectancy, but low expenditure, Malta, Cyprus, Slovenia. High spending, but underwhelming results. It's Poland and Germany. Italy is remarkable, nearly zero growth, yet gained 2.5 of life expectancy.
Yep.
All right. Um, so private burden, high private spending tends to associate with lower life expectancy, but they're also ones that break the pattern. So it's very
Yep.
murky. This is arguably the starkest finding in the data. US life expectancy was right at the EU average in 2002, and 2023 is now 2.4 years below the EU average. Okay, so this is, we don't have the US spending, but that's interesting. So the data suggests that how health money is spent matters more than how much. Okay, so I'm going to ask it to include the last data set. So we have also a data set on how the what is it called here? On the
Spending purposes.
spending purposes. The spending purposes. Does this change the picture? Okay. This is also maybe not the greatest question that I put in. Does this change the picture?
But it's a nice open one. It's not saying show me how this changes the picture.
Yeah,
You
exactly.
haven't prejudged it.
No. And then again, it's gonna write a Python script. After this one, I'm gonna wrap up, and I'm just gonna show you how I would continue. This, so basically, once it gives me the answers,
Mm-hmm.
and now I built quite a lot of context by now, because
Yes.
so now the model also knows about. It's not only me that knows about this, but it's also the model that knows about this. And this is where I was talking that this is like a collaboration between you and the model. So the purpose data add much sharper picture. Okay, do categories stand out as a
Whoa.
strong correlation? So long-term care and medical goods. More medical goods, shorter lives. Okay.
Whoa.
All right. The long-term care. So countries that devote a large share to long-term care have strategic life expectancy. Okay. These make intuitive sense. Long-term care spending reflects a system geared towards keeping elderly populations alive and well, not just treating acute illnesses. Okay. Medical goods, share drugs, devices show the opposite pattern. The more a country spends on medical goods as a share of total health spending, the lower the life expectancy. All right, this likely isn't saying drugs are bad. It's saying that the poorer health system spend disproportionately on medications and not enough on healthcare services. Okay.
When you look at the countries mentioned,
Mm-hmm.
it's not, in a way, it's not surprising. I mean, particularly Bulgaria, Romania, and to a certain extent Hungary and Latvia. They're still only 30 years, where are we? Less than 40 years post end of communism. And they're probably, a lot of that medical good stuff is modernization.
Mm-hmm.
and they had an underlying bad life expectancy. So I think, I'm guessing, so it's still low because it doesn't, you can't have instant results.
Mm-hmm. Yeah.
Um,
Yeah. And
so
this is
it's
also a limitation of the um, uh,
it's a bit
reasoning.
it's a bit like saying, if you have poor people have low life expectancy, therefore money is good for you.
Mm-hmm.
It's
Yeah.
there's obviously there's a correlation, but it's not the cause.
Yeah.
Um,
But I think this is what you, as a journalist or as a data journalist, the data analysis, you encounter this yourself, right? Because if you do this analysis yourself and you
mm,
find this trend, it's still there.
mm,
It's just not this much in your face. That's why I'm saying also distrust and verify everything.
yeah.
Yeah.
And I'm looking at
Yeah.
the bottom of your screen. It says the story across all three data sets is it's not how much you spend or even whether the government pays for it. It's whether the system is built around long-term care and services versus just dispensing medication. I think that's oversimplified, but I think the first part of that is worth
Mm-hmm.
exploring. What is a system built around long-term care and
Yeah.
services? The other
Mm-hmm.
reason for that correlation is that wage levels will still be low
Mm-hmm.
in those countries
Yeah.
compared to the north and the northwest of
Yeah.
Europe. So it's still cheaper. You could have, I don't know the current wages, but you could have more nurses per patient
Mm-hmm.
in Romania than you can in Netherlands, say.
Mm-hmm. Mm-hmm. Yeah. Yeah, and this is what when you would add new data sets to this analysis,
Mm.
then what then you get back is like this changes everything, from the model
so
often. So yeah.
so at this point, though, with looking away from Claude and just being yourself as a journalist who's good at investigation and good at following money around,
Hmm.
what are your instincts telling you? Where do you think you might want to look further? Obviously, I'm pretty sure there isn't a really great story in this data, but there are some pointers to possible stories. What
Yeah.
would you be looking for now?
Yeah. So I I think there was this um I'm actually really curious about these fast growing health systems
Hmm.
because I have seen from my experience from Slovakia, it's not necessarily good, and it does not always come with like in Slovakia we had this growth of a health system that was also spurred by private investments from a um, like basically investment company, right? And they are looking into mostly how to extract value for their shareholders from healthcare. So I'd be curious is actually what does it mean that the health system is growing, and
Mm.
is it that good? Is that not good? So I would be kind of going into this, I think. Um, from the top of my mind, because I'm also in no way a specialist, right? So from this point on, what I would do in terms of getting information from outside, I would probably start reading into like reports, start talking to people, and as an output of this analysis, what I can now say is like, uh, so I can say I'm gonna copy this and I'm gonna say I am a investigative journalist. And from the trends we saw here, I got mostly intrigued by this. Okay. Please make me an explorative Jupyter notebook with um that helps me understand this better from the available data. What I also would say, okay, let's say this. And from here on, like this would be the end probably of my exploration, right? So this would be
Mm.
the end of my context building. This would be like the first question I had for this model. And at the and an output, I have a Jupyter notebook. And what I would also ask it is like, with this in mind, give me suggestions on what other data sets to connect it to, for example. And then I would, for anything that comes after this, I would clear the context and like do completely new thing, right? So what I could also ask it now is to build me a dashboard and whatever. You can go crazy. But I'm not really there anymore. But I think I always like to, um from most of these like exploratory iterations, I like
Mm.
to keep some sort of an artifact that I
Yes.
can then come back to. And that's why I'm
Yeah.
asking for a Jupyter notebook.
Well, nobody's perfect. You could have asked. You could have asked for an R notebook. Yeah. I think.
So, what do you
I
think?
think
What?
that. I think because we're nearly at the end of our sort of the
Yeah.
time we've allotted. I think that's really interesting. I. You can probably guess. I had a couple of ideas in mind,
Hmm.
but it's taken us into an area I hadn't thought of. And
Hmm.
it's well worth exploring. I mean, this whole thing in many governments around Europe, when people worry about the health service, and then government says, "Oh, we're going to spend more on health." So
Yeah.
it's equated spending with growth of the health service, if you like.
Yeah.
And we don't know what that is now. Infrastructure, people,
Yeah.
operations, the scope of what they do, but it's a great it opens up a whole set of questions which would be
Yeah.
worth investigating. I could imagine it's actually quite a good cross-border investigation to sort of say
Could
what's
be.
going on
Yeah.
in your country.
Hmm.
It's interesting that it's spotted the faster growing uh, systems.
Hmm.
So yeah, for me that was the first to see it done live, to do so much Claude, asking AI for help. I've done a little
Hmm.
myself, and it always gives me at least one angle I would never have thought of myself.
Hmm.
Um, so I thought that, yeah, I think that was really interesting. And you, unfortunately, it didn't make you struggle. So the revenge is still missing. Uh,
Well.
or I've learned that next time you throw me something, there is no way I'm doing it on my own.
Well, wonderful. So,
Yeah, so we all learn something.
yeah. Well, and if this was like a real life situation, right? Like if
Mm,
this was a real investigation, I would probably already have a sort of an angle, sort of an idea. Um, I would probably also have more knowledge because I have very little knowledge of health systems
mm,
currently. So going into this analysis without prior knowledge is also not what you would usually do. Although I have done it wasn't an investigation but a project recently that's going to be published next week, where I've done that, and I actually
mm,
used this exploratory analysis to give me trends, because it also had to be done very quickly, then to give me trends and give me like macro um, overview of like what this data shows. And it was super helpful because I would have otherwise spent a day or two only on that, and in
mm,
this way
mm,
it took me a couple of hours, again with the caveat of I probably did not find the same stories um, than I would by myself, or
yeah.
maybe I don't know. So that's always this. It's as I said, it's a collaboration, and It can
Yeah,
pull you towards something that you wouldn't go without it, or but it can also show you more than you would have found by yourself.
certainly different angles, and
Hmm.
maybe that means we journalists and AI, Claude and his friends, we each have prejudices, and we come with those.
Yeah.
It's really striking the way that it's been programmed, or rather, it's teaching. It has a very American point of view about what constitutes your own money,
Hmm.
um, as if government spending is some
Yeah.
other
True.
completely different pot. Um, it's like that one of the things that they did in I forget if it was Steve Bannon. No, it was another guy, one of the sort of PR influencers in the States when they had Obamacare was coming through, and he wanted the Republicans to get behind a simple message, and it was keep the government's hands off our Medicare. So hang on a
Oh,
minute,
yeah.
whose is it? And it was a completely weird. But that kind of mentality is secret,
Mm,
is buried in there. Very
yeah.
interesting.
Yeah.
Thank you very much.
Yeah. Thank
We'll have
you.
to think of some more.
Thank
I'm going
you.
to have to look harder for data to confound you next time.
Thank you.
But
Thank you for this data set. I think it's super interesting. I just wanted to show like the notebook that it did.
nice.
Um,
Could you send me a copy
and
of it, please?
yeah, of course.
Thank you.
I'll send you a Quarto PDF because I'm also now Quartoing.
Excellent. I love Quarto. Okay. Thank you
Yeah.
so much.
Yeah, thank you, Jonathan.
And we'll do
And
this
thank
again sometime.
yes, let's do it. All right.
There's
I
you.
I just wanted to say that this is a screencast from the pond and we do this once or twice a month. So I will put a link in the description of the video. If you want to join us, feel free. Bye.
Bye. Thanks, Ada.